Today, I am going to do something out of the ordinary, and I am going to show you a little bit about what I do when I'm assessing a dog for an unknown injury. The reason I'm doing this today is because Ben has been showing something is off, and I can't really tell what it is. There is sometimes a day after sheep herding, he'll be limping a little on his right front. So first I'm going to start with his neck. And the reason I always check a dog's, well, I always check a dog's neck, but quite often for people that have been to the vet, had x-rays done because they're limping in the front and they don't see anything in the actual leg. And very often front limb lameness can actually come from the neck, specifically the last two vertebrae, C6, C7. So what I want to do is just assess him. And I actually haven't done a full treatment on him. I do things daily with him, but never a full treatment because, well, you've heard of the shoemaker's sons or daughters or whatever. Well, I'm one of those. But basically, I'm going back and forth and just checking to see if there's any areas that are a little bit tender and I don't look for a dog to cry out. I look at their ears and what their ears are telling me. Like right now, his ears are nice and straight up. Yes, he wants a treat. Nothing new there. But when I go deeper into here, I want to see, like, does he flinch? Sometimes the slightest bit of pain, a dog will either stop breathing, like hold their breath, or they'll start to pant excessively. So I'm just going to see here and check that C6 and go down in here. Nothing in there. Nothing in there. So I'm happy with how his neck feels. So now I want to do some checking of his spine, and I'm just going to be applying some gentle pressure. This is not chiropractic. This is an assessment tool where I'm just checking his vertebrae. You're being very good. You can see he's actually quite enjoying this. Let's continue on. And what you can't see on the camera, but when I'm pushing down here, there's some what are called fasciculations. And many of you may have seen this with your own dog. You're rubbing here or pressing or doing something like this, and you'll see the skin kind of quiver. And that's basically a muscle spasm or a trigger point in many cases. Oh. So is that a reaction? Because he sat down, he quickly went like, ooh. So what I'm going to do is get him to stand up again, and I'm going to repeat it and see if that happens again, or was it just he decided to lie down. One of the other things I've noticed, and this is because I do what I do for a living, it's sometimes could be a curse, but I've noticed that with his left hind, he's often sitting with it out to the side. And as many of you who have seen all my videos know, a square sit is, to me, the piece de resistance. In other words, if they don't have a square sit, then I'm starting to think is something going on. Usually it might just be a learned thing, but anyway, so those are just two little things that I noticed with him. So I'm going to go back here again above and see if he does what he just did the last time. Good boy. And I do treat as I go along, and I'm just basically unlocking the facet joints. If I find a spot that is reactive, and you can see now I went back and he didn't react, so I'm not concerned at this point. With some dogs, this is how I would assess for any kind of disc issues, spondylosis, any other kind of spinal issues, seeing if there's any pain in there, and the reason I have my hand underneath is because one of the other signs that something is uncomfortable is when I press down, I will feel with this hand, I will feel the stomach tighten, which tells me that there might be some discomfort there. That's a good boy. Yeah. So now I'm coming into, this is the lumbar spine. This is where in older dogs, I start to see some issues here. Usually it's more spondylosis, i.e., for lack of a better terminology, there might be some bony growth occurring between two of the lumbar vertebrae, and that can sort of, once you start to get that, you get you don't get as much wiggle. That's it, wiggle in the spine, and you start to see dogs kind of, they may not want to shake as much their head because they don't want this to be doing as much wiggling. So this is now his lumbosacral junction. He's a little bit not happy there. So I'm just going to go and see. And what you can't see on camera is when I'm pressing here, I can feel on this side his muscle is shaking a little bit. Is it a little sore in there? And I'm not thinking anything traumatic, running to the vet kind of thing. I'm just thinking, okay, something's a little bit locked up. He is a very active dog, runs like the wind, and being a border collie, anyone who knows about border collies, they are the smartest breed, but sometimes I really question that. Like, he'll go running and turn like this to look at, I don't know, another dog or a sheep or whatever, and then crash into something. So anyway, so I'm just going to press down. And I'm doing this, as I mentioned before, because something just doesn't seem right. And I just want to make sure that everything is right. See, he's just not happy there. You're getting some changes there. Hey, buddy? Let me just see if I can unlock this. So actually, he's a little uncomfortable there. So something new that I've started, I just finished a course using a tuning fork. Great for acupuncture points, as well as some myofascial trigger points. It just depends. Every tuning fork has a different wavelength. And it doesn't bother the dogs at all, thankfully. And I'm just going to stick it on this point. Interestingly, I tried this on myself. I have TMJ, and I thought, it's always hurting. And so I used it on myself, and it went away for a couple of days. So we're going to give this a whirl here and see. As my osteopathy teacher used to always say, we would do a treatment on an animal. She used to come by and check for quality control. So what I want to see is if after I've done this, does it feel better? Is he going to let me touch it more? And this is also an important acupuncture point called Bahwei, and sort of master of the spine. It's good for hind end issues. So any of you that go for acupuncture will probably see them put needles in this spot. And you can see he doesn't react to it. I do teach my clients how to use this. So we're going to get him to stand up again. And yeah, it's a treaty. Come on, stand up. Yeah, good boy. Oh, there we go. Now let's just check it. Quality control. Does he seem a little bit better here? Maybe yes. No, he really is not happy. Now, where do I go from here? All right, all right. You're not happy there. We're going to have to get that looked into, aren't we? Ugh. Okay, lie down. So I'm going to move away from that. I'm going to store it in my brain because I may get them x-rayed. I'm a big fan of x-rays to rule out things, see what's going on, and then I can decide how I want to proceed after that. But one of the things that I'm going to check is it could be his SI joint. So what I want to see, and that would, to me, make more sense. So let me just, yeah, good job. Good job. What a good puppy you are. What's your mama doing? What's your mama doing? So let's just see. So what I'm doing is stabilizing his sacrum and pushing into the hip joint and trying to see if I can mobilize this SI joint. And then I'm going to go back and check it, see if that did anything. And I'm going to move this way. With some dogs, when I do this, it's painful and their SI joint is out. They have dogs. One of my great instructors, Laurie Hughes, I took a course of hers. Actually, took it 3 times, but she did her master's in the SI joint, and there is, oh God, I hope I remember this, 7 degrees of movement in the SI joint in dogs. Apparently, in humans, there's only, I think it was 1 millimeter. My physio told me. And anyone who has SI problems like myself know that it is not fun. He's actually really enjoying this. So we did that. Let's just check his knee. I just want to make sure that everything feels okay. You're a little tight in there. You might be. If I'm checking for a knee injury, I want to see, usually if they have a knee injury, they don't like full extension. I don't expect that in him because I don't see any particular limping per se. I'm going to check his hock. And a big thing that me included, and I learned from another great sports vet in the USA, in South Carolina, I believe, Robert Gillette. And one of the things I learned from him is he believes that many injuries start with the toes. So now every single dog I see, I always check their toes. And just an FYI, if you start from this way, I've learned they don't like it because they associate that with having their nails clipped. So what I'm doing is just checking, does this bend properly? And I'm going to be checking his front right. Um, and I find if I come from the top, I don't feel any difference. I don't feel any thickening of these toes. So I'm happy with the back leg. Now I'm going to check the front. I'm going to check how the scapula moves. And just an FYI, if you go to your vet or go to someone and they do this for checking shoulder extension, that is not really checking shoulder extension. It's actually because the scapula just moves on the ribs, the shoulder joint is here. So if you really want to check extension, you need to know landmarks. But I'm holding the scapula and bringing this forward. And the reason, because I mentioned there's on and off lameness, so I want to see if there's anything going on in his shoulder, which is very common in working border collies. So I'm just checking. This is all good. This is good. That seems fine. Now I'm going to check the biceps tendon. So I'm fairly confident that whatever this limping is not coming from the shoulder. Elbow feels fine. I like to hold my hand, and I always teach my clients to put your hand over the joint. I'm not squeezing or anything, but what I'm doing is feeling the motion and seeing if I feel anything with my hands, like any crunching or crackling. And this is where I actually think the issue is in his carpal joint. I'm probably, if this persists, going to get him x-rayed just to make sure that there's no arthritis in there. Of course, today, see right here, right there, I can feel, and the more I move it, the less it is. So I kind of feel like there might be some arthritis in here. Oh yeah, like right at end range. I'm going to do some laser on that. This laser class 3B is really safe. But now I'm going to check his toes. I know you don't want me touching this one, and this one looks swollen. So it feels fine. I know, I know. This is why my back is so messed up, is from how I position myself. I'm just comparing the two. Just don't touch my front feet. I don't like my front feet being touched. So because I have a laser, I am going to laser that. Stay there. Stay. And just so you know, most of the clients that I deal with, their dogs fall asleep on my table. You know, if you're going anywhere and your dog is constantly trying to leave, unless you know your dog has a lot of stress issues, but even the most stressful dogs will, after the first couple of treatments, will just fall asleep on my table. But if ever you feel like something's not right, listen to yourself, because you know your dog better than anybody. I guess another thing I should mention that's important is when you're going to a rehab professional, if there are only ways, I call this the magic laser wand, if they're only using a laser on your dog and they're not doing any manual therapies like massage, myofascial release, acupuncture, anything, I think, you know, laser and the underwater treadmill, many of you know my thoughts on the underwater treadmill. I had one for 15, 16 years. I think it's a great tool for some things, but I think it's become a tool of just throw your dog in the underwater treadmill and it fixes all. And I really think that in our profession that people need to learn more about their manual therapy skills to really have a wide variety of tools to use on each individual patient, because every patient needs something different. All right, let's get you up. Come on. We're going to do quality control. And then we're going to do the other side. Now, let's see. So remember I did that mobilizing of his SI joint. So let's see now when I press down. If you remember before, when I would press down, he would try and bring his legs over my arms. Well, he's doing it now, but I think he just wants to leave. Come here, you. Go in the camera. He's much less reactive now. So I suspect that the issue I was seeing was his SI joint was just slightly out of whack. As I mentioned in the very beginning, I always check the whole dog when I'm, even if they've had a TPLO or anything, I always check the whole dog because they're quadrupeds, i.e. 4 legs. If there's a problem here, it can manifest here. So, or because of compensation. So I always want to check the entire dog and just see if there's any other issues, compensations. So that, my friends, is me assessing my dog. So overall, I would say his right SI joint was a little bit out of whack, not surprising. He might have a little bit of arthritis in his carpal joint here and this toe right up here. I feel like it's right there. So if I remember, I'll do a follow-up video whenever I get an x-ray done and let you know what happens.